Good morning, everyone. My name is Cynthia Mahoney, and I am here with my colleague Margie Chen and the Voting for Climate Health team to talk to you about healthcare-based civic engagement, a prescription for the climate health crisis. I want to start by thanking Brandon for inviting us to speak with you all this morning. We're really excited to connect with people who are on the front lines of the climate crisis, the climate health emergency, and people who are engaged with patients who are at high risk of pollution and climate change impacts. As I said, I'm Cynthia Mahoney. I'm a retired nephrologist from the Danville, Contra Costa County area. And I'd like to introduce my colleague, Margie Chen. Margie?
Hi, I'm Margie Chen. I'm a retired OB/GYN in San Francisco.
Right. So I'm going to take a moment to share my screen and we'll get started. All right, is that visible for everyone? Great. So just before I get into the main content, I want to give you a little bit of background about how the Voting for Climate and Health team came to be. We started out with Climate Health Now, a group of over 600 health professionals across California who formed back in 2019. And we were so excited, so happy to find each other, a group of health professionals who understand that climate change is a threat to the people and places we love, and who want to use our trusted health voices to advocate for effective and equitable climate action. We knew it was important to encourage our patients to elect leaders who would act on climate. So when COVID struck, we saw that the act of voting itself was a direct health hazard and knew we had to do something more. No one should have to choose between their vote and their health. So we joined forces with the Union of Concerned Scientists to encourage no excuse mail-in voting across the US. That was an eye-opener. We were appalled and outraged by what we saw, the rampant voter suppression and the efforts by powerful forces to undermine democracy and prevent climate action. We learned that voting is a social determinant of health. That's when we knew that our work with civic engagement had to continue beyond COVID in order to support climate action and health equity. We branched off from Climate Health Now to form the Voting for Climate and Health team. We know we can't solve the climate health crisis without a healthy democracy where all voices are heard in free and fair elections. And our remedy is to use our trusted health voices to help patients understand, to connect the dots between voting that gives them a voice in the policies that affect their environment and therefore their health. Our mission is to engage all health professionals in doing this across California. We believe that as trusted health professionals, we can help our patients make that connection. And as health professionals, we have a unique relationship with our patients, many of whom are harmed most by fossil fuel pollution and the climate crisis, yet aren't registered or consistent voters. Elected leaders respond to people who vote. People who vote influence their health outcomes. Voting is a climate solution. So our goal today is to show why voting for climate and health and civic engagement is good for our patients and is in our lane, and also how it's good for us. So we'll connect fossil fuel pollution, the climate crisis, and democracy. We'll talk about the American Medical Association resolutions on climate and on voting, and then discuss the changing role of health professional advocacy around civic engagement and show that this is our lane. And then we'll introduce some simple nonpartisan tools from an organization called Vot-ER that make it easy for us to help our patients with civic engagement. We want to motivate you with urgency, equip you with the tools for agency, and generate hope with collective action on the climate health emergency. By the end of the presentation, you should feel comfortable that this is our lane and familiar with the quick, easy tools from Vot-ER. Before I talk about the civic engagement part, I want to frame this with why this is a health emergency. And to start with the scope of the climate health problem and in relationship to fossil fuels. So we know that fossil fuels and climate change are intimately involved, the twin scourges of fossil fuel combustion. And the harms extend all the way from extraction to refining and distribution to combustion in power plants and even in our homes. I'm sure you're all familiar with the criteria pollutants, PM 2.5, ozone, and toxics that cause direct multi-organ system toxicity, most notably lung, heart, and neurodevelopmental. Focusing on the lung, which I'm sure you're most concerned about, we know about asthma, infections, and cancer, and predominantly think about outdoor pollution. But now we're learning also about indoor air quality, about the problem with gas stoves. I'm curious how many of you have patients who have gas stoves and whether they're aware that those gas stoves can actually be triggering asthma. A new study shows that in California, fully 20%, that's the third bar down, 20% of asthma cases can be attributed to gas stoves in homes. And of course, those pollutants make people more susceptible to COVID. So that's the direct toxicity of pollutants. But burning fossil fuels also releases greenhouse gases, GHG, notably methane, which is the main component of natural gas, and carbon dioxide, that have indirect health impacts because of climate, they cause climate change. And as well, there's direct CO2 toxicity of indoor air or air enclosed spaces where the CO2 can rise too high. But that's for another talk. So let's look at the health impacts of climate change per se. Climate change is driven primarily by burning fossil fuels, although there are other causes from land use and agriculture. The impacts are here and now. It affects everyone, although some groups are more vulnerable. And the spectrum of diseases can be abbreviated with the acronym heat wave. And I've listed many of those conditions here. I'm not going to go into detail on that, but just to point out, as far as lung health, heat causes ozone formation and worsened air quality. Drought releases more dust, poor air quality, and increases infections like coccidioidomycosis. And I'm wondering if you're seeing that in any of your patients, especially in Southern California. And then there's wildfire smoke. Raise your hands if any of your patients have been affected by wildfire smoke, you or your families or your patients. I think back to October of 2018 and 2019, when I couldn't go out and enjoy the most beautiful days of fall because of the smoke choke in the air. And my asthmatic daughter was a prisoner of the house and need to stay in proximity to air filters. In public health, we've become used to thinking about climate change in cooling centers, but now we need clean air centers as well. And we know that wildfire smoke is very toxic and it spreads across thousands of miles. You see in the photo above California, the little red dots that show wildfires and the smoke stretching all the way to the East Coast, triggering heart attacks, strokes, and pregnancy complications. Lately, we're seeing the effects of flooding, which of course can trigger mold and more lung problems, and longer allergy seasons. So the impacts are broad spread and very, very severe, and will only get worse as the climate heats up more. So it's widely accepted that climate change will be the single greatest determinant of health in the 21st century. This is indeed an emergency and something we all need to find a way to impact. We know that we need to transition as quickly as possible to clean, healthy forms of energy like solar and wind. And it's not all bad news. There will be enormous health benefits of a clean energy economy, saving thousands of lives, millions of lost school and work days each year, with health benefits valued at $200 billion per year in the US alone. That's from the climate change health impacts. And then, of course, there are the health benefits of avoided pollution, which are immediate and local and already valued at over $500 billion per year in the United States. So there are lots of benefits of a rapid transition to clean energy. If you look on the right-hand side, the graph shows that most voters want more climate action, including regulating CO2 as a pollutant, more clean energy vehicles and solar panels, teaching about global warming. But why haven't we done more? Well, climate change, which back in the 1990s and early 2000s was bipartisan, has been politicized. The fossil fuel industry has funded denial, doubt, division, delay, disinformation, and now distraction with greenwashing. They fund lobbying, campaign contributions, PR campaigns, and so-called education. In fact, it's important that as health professionals, we stand up for the science and speak about the health impacts and solutions, and also engage in countering all of this disinformation. Now, some health professionals and healthcare institutions have been reluctant to engage in this effort and afraid it's too political. And that's why we were thrilled that the American Medical Association just this summer passed a resolution saying that climate change is a public health crisis. And to me, that means this is mainstream. We can and should be advocating for this. And as health professionals, we have a special role. We have a duty to protect our patients, to warn them and prevent what we can. We know that the individual care we offer in our own clinics or in individual homes isn't enough to counter the tremendous adverse impacts of climate change. So we recognize the root causes and can advocate for mitigation and adaptation. And we're in a special position. We have a unique connection to our patients, especially where patients are disproportionately burdened by air pollution and climate impacts and may have no other civic contacts. And in addition to our trusted voice with patients, we have unique trust and authority with policymakers. So climate change and civic engagement are in our lane, and this is becoming more and more accepted. Medical schools and medical societies are not only engaging, but they're teaching social skills such as advocacy and civic engagement. And I'm showing this largely to point out, if you'll see the list of a few of the organizations that are involved, you'll see the American Lung Association, the American Public Health Association, the Allergy and Asthma Societies are all involved in these efforts. So let's step back for a moment and look at where climate change falls as a social determinant of health. If you look at the bottom social determinants and move clockwise to income and wealth to physical environment, climate change has been called an environmental determinant of health. But of course, the unique thing that makes it a social determinant is that it's human caused. But the impacts are inequitable and multiplied by other social determinants of health, like low income, like racism, and poor health access. And if you look beyond the social determinants to the larger blue circle, the structural determinants, we know that it's the policies that are driving this, that industry is blocking action, and that's where we need to intervene if we hope to slow global warming. In fact, prominent public health people have said that voting is in fact the most important aspect of the political determinants of health. And that's where we want to intervene. This isn't just theoretical. There's actually evidence that the better the voting access, the better the health. This Health and Democracy Index shows that if you look at a basket of 12 common health indicators in the upper right, that better health correlates with more voting access. The states that have better voting access have better health, and conversely, in the lower left, those states that have impediments to voting access have worse public health. And this means that there's both a vicious cycle of decreased civic engagement with less inclusive health policy and worse health outcomes. But on the left, we can create a virtuous cycle where increased civic engagement creates better health policy and better health outcomes. And the American Medical Association recognizes this link as well with a resolution in June, not only that climate change is a public health crisis, but that voting is a social determinant of health. Again, making it mainstream that health professionals get involved in this area. Now, how helpful can this be? Well, it turns out there are 51 million unregistered voters in this country. That compares to 150 million people who voted in the last presidential election. So it's a huge percentage. And there's an overlap between these unregistered eligible voters and patients most marginalized by our current health system. And that's the young, low-income people and patients of color. What would happen if these people became engaged in their health and through voting? How much could that change and improve their health? Well, we know that when nonprofits like Vot-ER engage patients, it does work to improve turnout. This graph shows by race that civic engagement in the clinic increases voters across the board, but especially for voters of color. And we could show similar graphs pointing out the relationship to increased voting, especially for youth and especially for low-income people. But for all voters, it helps. So to summarize this part of the discussion, we've learned that climate change is a public health crisis, really an emergency, and that the people we elect determine the conditions of our health. We've learned that voting is a social determinant of health, and when patients are voters, health improves, and that we as health professionals have an incredible power, our trusted health voices, and also a unique connection to our patients, many of whom are not registered or consistent voters and may have little other civic engagement. So we conclude that voting is a climate solution, and this is in our lane. So what can we do? We can connect the dot for patients between their health, climate change, and fossil fuel pollution and voting. We can get health professionals and patients civically engaged through registration, turnout, and interaction with elected officials. We can talk to our patients about climate change as a health issue to depoliticize it and build collective will. And we can press our elected leaders for more bold, equitable climate action. And now is the time. We've passed the major election, but in fact, this is not a downtime. This is a time to build in a time when things are not so partisan. And also local officials will decide on major spending that's going to impact our patients, like the Inflation Reduction Act, the infrastructure bill, and regulations. So we want to encourage everyone to be a voter. Now I'd like to turn things over to Margie to talk about tools to make this easy for us to do. Margie?
Thank you, Cynthia. So now we'd like to introduce you to Vot-ER, an easy tool to help your patients register to vote. By voting, our patients can be empowered to have a voice in policies that determine their health. And you may be muttering under your breath that you do not have time or energy to cram one more thing in your time challenge visit, and I get it. In an article about burnout in healthcare workers, our Surgeon General, Dr. Civic said, burnout is not only about long hours, it's about the fundamental disconnect between health workers and the mission to serve that motivates them, and the moral injury from being unable to provide the care patients actually need. So voting and civic engagement can be an antidote for burnout. A 22-year-old patient said, if a doctor told me I could make a change by voting, I would be like, yeah, totally. It shows they really care about us. An ER doctor in Ohio said, I'm continually energized when talking to patients about this. It's been great for my own mental health. And the law supports voter registration in nonprofits. The National Voter Registration Act of 1993 actually mandates any office providing public assistance of state-funded programs like Medi-Cal, Medicare, or WIC must offer voter registration. So our organizations are obligated to conduct nonpartisan voter engagement activities, especially designed to help the public participate in election, voter registration, voter education, and get out the vote. Next slide, please. This is a short video about Vot-ER and how to use the QR code.
For providers like me, we can do something small but powerful to ensure that our colleagues and our patients have a seat at the table.
We've created the Healthy Democracy Kit to help you do exactly that. The Healthy Democracy Kit consists of a Vot-ER lanyard, badge backer, that you can make a part of your regular ID cards. Badge backer that you will receive displays a QR code along with a text code that will direct patients to a nonpartisan online voter registration portal that's specific to their state of residence.
In our Vot-ER Healthy Democracy work, we have a few core beliefs. We believe that empowered voices in communities lead to positive health outcomes. We believe that by voting for our health, we can preserve what works or demand change for the things that don't. We believe that our healthcare system is stronger when we, as providers and as patients, all show up.
This badge allows you to register to vote on your own phone. All you have to do is shoot your phone at this QR code or send this text message to this number, and the platform walks you through all the steps to get ready to vote or request your mail-in ballot in 90 seconds. I gotta go see another patient, but the platform will walk you through the rest.
Of course I'll register to vote, but who are you voting for?
I'm voting for you and your health.
With all that's going on with COVID, I really want to make sure that you can vote in the safest and healthiest way possible. The best way to do that would be to vote from home. I can help get your vote from home ballot while you're here at my office today. Every time I feel like a Groundhog Day, from now on, I'll ask my next patient, are you ready to vote?
As healthcare providers, we cannot turn on the barriers to equity by any one prescription or procedure. We know the limits of our reach. We also know the power of the vote.
Thank you. It may seem awkward or uncomfortable to bring up voting in your visit. Here are some easy ways to incorporate the subject in the course of your visit. As you greet your patient, you can say, hi, how's it going? How's the family? How's work? Are you registered to vote? Or it can be part of your social history. Do you smoke? Are you using your seatbelt? Are you safe at home? Are you registered to vote? It can be at the end of the visit. Before I leave, I'd like to check whether you are registered to vote. Your vote is a powerful tool to address and improve the issues you care about, like your health. We know that climate change has made pollution and heat worse. These issues can worsen your asthma symptoms. Through your vote, you can have a voice on whether your community has clean air, water, and a safe environment to live in. Next slide, please. So let's take some time to make sure that you are registered to vote. To see how easy it is to register to vote, you can use this QR code right here on the screen. Just point your camera to the QR code and it will take you to the site that registers and checks your vote. So let's just take 60 seconds and check your registration.
Are you timing this, Margie?
Mm-hmm.
And we're doing this to show you how easy it is. This is what the patients would do. And also because too many health professionals themselves aren't registered. So we want to heal ourselves first, of course.
All right, so that's 60 seconds. and see how easy it was. And hopefully you'll see that it's very easy for your patients to get to that portal to register to vote. Next slide, please. So now let's try to get your own badge. So this is what the badge looks like on the lanyard. All you need to do to order the free Healthy Democracy Kit, which is this lanyard and badge with the QR code, you just have to scan this QR code on the screen as well. So all you have to do is point your camera and link to that. And we will also have the link to getting a badge on our chat. Next slide, please. This cartoon is a little hard to see, but it's Cynthia's favorite, so we included it. It shows a map of the United States sick and in distress. And the medicine around it is, the medicine that's going through the IV bag is voting. So this is what we can do to help our patients. Together, we can create a healthier democracy and build stronger communities for a livable planet. We invite you to consider integrating civic engagement into your RAMP practices by using the Vot-ER tools to improve your patient's health. Cynthia and my contact info is on this slide, as well as the link to the Vot-ER, which there are many more resources, posters for your office, scripts for conversations to start with your patients. And we also have our Vote for Climate and Health landing page. So thank you so much for inviting us. And now we welcome any discussions or questions. And some things to discuss or think about could be, do you think that your patients have connected the dots between their asthma to climate changes to their environment? Do you think that civic engagement and voting is something that can empower your patients to ask and demand better health? Do you think that this is something that you can incorporate into your practice? If you have any questions or would like to get more information, please contact Cynthia or I, and we'd be happy to speak with you. Thank you so much.
And I'd like to add just a couple of things to the questions that Margie posed. Most of the people that we've been working with so far on this have been specific sites and clinics. That's most people's experience. So we have, for example, in the Bay Area, a Stanford Pediatric Clinic that has integrated this into their flow. So when the patients come in, the medical assistant has a badge and says, oh yeah, your doctor's likely to talk to you about this. And at checkout, there's a poster saying, oh, are you registered to vote? So by integrating it into the practice, it makes it easy. It's not a burden on any one person. And the conversations, as you saw, can be very, very short. Are you registered to vote? We know it's good for your health and your community. It could have an effect on your asthma, and we could clean up the environment here. Just shoot this at the camera or at the QR code, and that will take you through it. So the provider themselves isn't actually doing the registration. You're just guiding the patient towards the fact that it's going to benefit their health and a site where it's easy to do. But I'm curious as to how this might fit with the RAMP program, where you're actually going into patients' homes, whether that's something that you think might work. Would it feel uncomfortable? Would you need help integrating that or figuring out how to actually implement it? We'd be delighted to talk to you about it. We don't know ourselves. We're all learning as we go along, but we know that this is important enough that we're trying to look at every opportunity. And if you know people in clinics and offices and hospitals, please introduce them to the program and connect them with us, because we want to get this as widespread as we can. And lastly, Margie, I'm going to ask you, what do you think is the most frequent question that people have when they first start to think about trying to work with Vot-ER tools and integrate this in their practice?
I think people are feeling most awkward, like, why should they bring this up in their conversation? But I think Cynthia, you pointed out so well how civic engagement improves their health, and that they should demand a better, healthier environment that impacts their health. So I think connecting dots for people and so that they realize, especially with lung health, how their air quality impacts their health, and that they can impact the air quality by approaching the legislators and the policymakers who are dictating how the standards for air quality. So I think it's really decreasing the barriers to thinking that that's not our role. So I think it's just really seeing that we are advocates for our patients' health.
Mhm. Right. So we're both providing the best individual care we can for the person in front of us, but we're also connecting the dots and connecting to the community and the collective action we need to improve the conditions for everyone's health. All right. And as just a very simple thing, one question that I hear a lot is, well, what if my patient isn't an eligible voter? Will they feel bad, or could I get in trouble? So I would say what a lot of clinics have found, and this is the legality, is that you can encourage people to take a picture of the QR code or the text number and share that with people in their lives who are eligible voters. So maybe their children, maybe their neighbor, maybe their spouse. We don't encourage people to vote who aren't eligible, and when they go on the site, they'll find they're not. So we don't encourage anyone to vote who's not an eligible voter, but we do encourage communities to get involved and as many people to be who are eligible to vote as possible. That's our strength. All right, well, any other final words, Margie, or shall we close up?
No, I hope this has been very useful and inspiring for you all.
And thank you, Margie. Thanks again for having us here. And please do reach out if you have any suggestions, questions, ideas, or people to connect with us, or you're inspired to work with us. And it doesn't, this is for the whole health community. So we're not just talking about doctors or nurses, but social workers are very prominent in this, respiratory therapists. It's across the gamut of healthcare people who can be involved in this and have a very important role. So thanks very much for listening, and we hope to hear from some of you. Goodbye.